All right, let's talk about a health question you've probably seen pop up online, one that's usually surrounded by a whole lot of myth and not a lot of fact. Today, we're gonna cut through all that noise and get straight to the science. So let's just get right into it. The big question, does ejaculating more often actually lower your chances of getting prostate cancer? Now I know it sounds a little like clickbait, but this isn't just some internet rumor. This idea is actually rooted in some pretty major long-term scientific studies. So what does the evidence really have to say? But before we can even begin to answer that, we have to get to know the main character in this story, and that is, of course, the prostate gland itself. So what exactly is the prostate? Well, you can kind of think of it as a small, walnut-sized factory that sits right underneath the bladder. And its main job, day in and day out, is to produce something called prostatic fluid. This stuff is a really key ingredient in semen. It's what helps nourish and protect sperm. And you can see here, the prostate has this kind of dual nature, right? On one hand, it's doing all these essential things for reproduction, but on the other hand, especially as men get older, it can become a source of problems, like enlargement, or the big one we're talking about today, cancer. And that brings us to a pretty sobering fact. About 1 in every 8 men will be diagnosed with prostate cancer at some point in their life. I mean, just think about that. That statistic alone is exactly why it's so important to look at every single potential factor that might play a role. Okay, so if there is a link here, how would that even work? What's the potential logic behind it? Well, the leading theory is something called the stagnation hypothesis. And honestly, it's a surprisingly straightforward idea. The theory is pretty simple. Remember that little factory that's always working, always making fluid? Well, if that fluid doesn't get cleared out regularly, it can just sit there. It stagnates. And the concern is that over time, this old fluid could expose the prostate's tissues to substances that might be harmful. So the idea is that regular ejaculation acts like a flushing effect, clearing everything out. You know, it's kind of like cleaning out a pipe to make sure nothing nasty builds up inside. So that's the theory. Makes sense, right? But what does the actual evidence from the big studies show? Let's dive into the data. One of the absolute most important pieces of research on this is a massive study that followed, get this, almost 32,000 men for nearly 2 decades. They tracked their lifestyle habits and, most importantly, whether or not they developed prostate cancer. The sheer scale of this study is what gives its findings so much credibility. And after all that time, sifting through all that data, one number in particular really stood out, and that number was 21. That was the approximate number of ejaculations per month that the study found was associated with a lower risk of prostate cancer. So what did that actually look like in practice? Well, the researchers compared the men who ejaculated between 4 and 7 times a month to the group that hit 21 or more. And what they found was that the high-frequency group had roughly a 20% lower risk of developing prostate cancer. That's a pretty significant link. Now for a question I know a lot of you are probably thinking, does it matter how this happens? And the short answer is nope. From a purely biological standpoint, when it comes to just flushing out the prostate, sex, masturbation, even nocturnal emissions, it all counts. The gland itself really doesn't care about the method. Okay, we've seen the numbers, we've seen the theory, but I really need you to pay close attention to this next part because it is, without a doubt, the most critical piece of this entire puzzle. We have to talk about what this research doesn't mean. This brings us to the most important rule in all of science. Association is not causation. The studies show an association, that is, 2 things are happening at the same time, but they do not prove causation, that one thing directly causes the other. It's totally possible, for example, that men who are more sexually active also happen to have other healthier habits, like a better diet or more exercise, and maybe those are the things actually reducing their cancer risk. We just don't know for sure. So let's be perfectly 100% clear on this. This is not a miracle cure. Hitting a certain number doesn't guarantee your cancer risk drops to 0, and it absolutely, under no circumstances, replaces regular medical screenings or talking with your doctor. And again, there is no official medical guideline telling men they need to aim for a specific number. This is just one observation, one piece of the health puzzle. So with all that important context in mind, let's zoom out a little bit and put this one factor into the much broader picture of what actually influences prostate health. When you look at the whole landscape, you really see where this fits in. The really big drivers, things you can't change like your age and your family history, have a huge influence. Then you have lifestyle choices like diet and exercise, which have a moderate impact. And ejaculation frequency, well, it's on the board as an interesting associated link, but it's clearly just one small piece of a much, much bigger puzzle. So what's the real takeaway here? It's not about obsessing over a number. It's about balance. It's recognizing that sexual activity is a normal, healthy part of life for many people. And maybe the most reassuring thing to come out of all this research is that there's zero evidence that it's harmful to the prostate, and hey, there's some evidence that it might even be helpful. And really, that's what it all comes down to. Instead of fearing your body or chasing a single magic bullet, the goal is to understand it. Listening to the science, making informed choices, and having honest conversations with your doctor, that is what truly leads to better health in the long run.